Hey everyone, my name is Dr. Jason Young. I am a chiropractor here in town at Body of Health Chiropractic and Wellness Center. And I was asked to do a presentation, give you some information about the field of chiropractic, what it is that we do, the types of patients that we see, kind of what the job outlook is, the day to day of what it's like to be a chiropractor. Now, normally I'd be there in the room, sweating in the heat with you because it's probably really warm. But unfortunately, unfortunately for you, or maybe fortunately for you, unfortunately for somebody, I have patient care today. And so what I decided to do was to just make a brief video that gives you some information about the chiropractic profession and why I became a chiropractor, and if you might be interested in considering that field, what it might be like for you. And if you have questions, I'm going to make my email address available, and Emily can get you that information, and I'd be happy to receive your emails and answer any questions that you may have. So sorry about the inconvenience of just having to look at me on the screen, and I wish I could be there, and it's best we can do. So I do have some notes that I'm going to be referring to, so if I'm like staring off into nowhere for a little while, that's what that's about. So I've been a chiropractor for 11 years. I grew up in Corvallis, and I went to high school here, middle school here, and then when I was going to Oregon State, initially what I wanted to do was business, and so I entered the business degree program. And as I thought more and more about business and what I wanted to do, I thought, well, I wanted to be a business owner. So I got to thinking about what kind of business do I want to have. And I wanted to make sure that whatever it was that I was doing, that I knew that at the end of the day, I wasn't just helping myself, I was helping other people. Now, I've been a chiropractic patient my entire life, like literally my entire life. So when I was born and I was 2 days old, there was nothing wrong with me, but my mom wanted to take me to a chiropractor to get me checked out. My sister had been going to a chiropractor because she's funny looking. I'm just kidding. That's not really the reason, but she'll never see this, and so I can say whatever I want. No, but my sister had been going, and so my mom had a good relationship with this chiropractor, and so she said, "Well, I'll just take him in and get him checked out." So 2 days old, I go, I get my very first chiropractic adjustment, and it's just really been a part of my life since then. So as I was thinking about what I could do as a business, uh, chiropractic seemed like it would be easy, right? So I was dead wrong about that. It was not easy to become a chiropractor, and I mean, there's some days where it's extremely difficult. But it's been a really good fit for me because philosophically it fits well with me. It accomplishes my goal of knowing that I'm helping people on a day-to-day basis, and I get to run my own business. Now, most chiropractors do actually own their own business. I think the number is around 60%. And so for some people, it's a really attractive way to go ahead and practice because you have that level of autonomy. If you were to become a medical doctor, which some of you I know are considering that, or you want to become a physical therapist or anything like that, quite often you're going to be working in a larger system where you're going to be told exactly the brand of healthcare that you'll be delivering, the drugs that you're going to prescribe, the procedures that you're going to do, how often you're going to do that, and it's not always coming from actual people. It comes from business managers and corporations, and so for some people that's a great fit. For other people, it's really unsatisfying. I'm the type of person that I would probably find that unsatisfying. So for that reason, chiropractic was a really great fit for me. And so I finished up at Oregon State. Actually, I transferred to chiropractic school once I reached my senior status at Oregon State. And I transferred up to a chiropractic school in Portland, University of Western States. And I completed my bachelor's degree in human biology there. I also completed my doctorate in chiropractic. I graduated from there in 2004. I also have another degree from that same university in human nutrition and functional medicine. And so a few things about chiropractic before I kind of get more into what my journey with it has been. So first of all, chiropractic is one of the fastest growing healthcare professions globally. You'll find chiropractors all over the world. It's earned recognition because of its effectiveness in using natural, non-surgical, drugless methods of treatment. And so today there's over 70,000 active chiropractic licenses in the United States alone, not to mention all the chiropractors that are around the world. And in the United States, chiropractic is the third largest healthcare profession. The only two that are bigger are what's called allopathic medicine, which is like your medical doctors and DOs. Like if you're going to the hospital, that's called allopathic medicine. And the other one that's bigger is dentists. And then after that, it's chiropractors, and everybody else is a distant fourth. It's also one of the best regulated professions, healthcare professions. It's licensed in every state in the United States, which means that there's regulatory boards which oversee the practice of chiropractic and function for public safety and protection. Excuse me, I'm sorry. So in addition to that, it is the largest alternative healthcare profession that is out there. So doctors of chiropractic will, first of all, it is a doctorate degree in Oregon and most states. Chiropractors are recognized as physicians, and so it is not improper to say chiropractic physician. Some of you may think, well, chiropractors aren't real doctors because they aren't MDs. MDs aren't the only kind of doctor healthcare providers out there. Now, there's also naturopaths and chiropractors and dentists, like we've talked about. And so, so chiropractors are doctorate. It's a doctorate level education. The type of degree that it is, it's what's considered a first professional degree. So there's academic degrees, like a PhD, for example, is an academic degree. A first professional degree would be like a DMD, or DDS, or an MD, or a DO, or a DC in the case of chiropractors. And so to become a chiropractor, you do need to, for most schools, you need to have completed a bachelor's degree, or like I said before, have that senior standing before you transfer in to finish a program. But more and more increasingly, a bachelor's degree is required. It doesn't necessarily have to be a bachelor's degree in health sciences. So I went to chiropractic school with people who had degrees in engineering. You do need to complete the prerequisites for a healthcare school, though. So like, for example, basic sciences like biology and chemistry and organic chemistry, things like that. You have to complete that in order to enroll in a chiropractic school. How competitive is it to get into chiropractic school? How difficult is it? If you have good grades and you can get student loans, it's not that tough. So there's no like MCAT or anything like that that's required. There's about 17 chiropractic colleges in the country, and they vary by location. And also philosophy, maybe some specific techniques that are taught. But I would guess that probably about 85% of what they're all teaching is exactly the same things. And it's basic sciences. It's the types of things that you would get in a medical school. So very heavy on anatomy and physiology, very heavy on things like biochemistry, spinal anatomy, neurology, and things like that. Where a chiropractor's training would differ from another kind of healthcare provider, like a medical doctor, is we spend a lot of time on physical diagnosis and dealing with conditions involving the neuromusculoskeletal system. So that's nerves, muscles, bones, joints, things like that. And so while we specialize, I'd say, in treating people's spines, so neck, upper back, low back, really chiropractors treat every joint that somebody would have in the body, with the exception of teeth, right? So that's a gomphosis, is a type of joint, but that's not one that we treat. So chiropractic actually began in the late 1800s. The founder of chiropractic was a man named Daniel David Palmer. Everybody called him D.D. Palmer. He had a son who was also a chiropractor later on after he developed chiropractic, whose name was Bartlett Joshua Palmer, but everybody called him BJ for some reason. The Palmer family just did it with initials. Okay, whatever they're into. But D.D. Palmer actually was a Canadian, and his family moved from Canada to the United States. But whenever they did it, they didn't all do it at the same time. So most of the family moved down to the United States. They could not afford to bring everybody, and so D.D. and his younger brother stayed in Canada. At this time, he was like a preteen, very young. So I think 12, 13, something like that. And he worked. He and his brother worked, and they saved up money, and they did a variety of jobs in manual labor, and eventually they saved up money to move down to the United States. But when they moved to the United States, they didn't move directly to where his family was. They actually made a few stops in different cities, and he was always had a very entrepreneurial spirit. And so he at one point was the largest provider of honey in the country. He had a specific strain of raspberry bushes that he would sell, and he would ship all over the country. And so he had all these different things that he would do. He was a teacher. He had a grocery store. He did a variety of different things. And one of the things that always kind of piqued his interest, though, was human health. And around this time, there wasn't a lot that was known about why people got sick and how they got better. There's a lot of theories, but we didn't know a whole lot. Germ theory was still very young, and while there was more and more evidence that was kind of bearing out that this is actually more than just a theory, it was a reality, it wasn't really well accepted by everybody. There was a lot of people that still practiced folk medicine. People thought that illness came from things like sin or bad juju or vapors coming up out of the ground, and so that's kind of the environment that his philosophies about health kind of came up in, was where there was not a whole lot that was known about what caused disease and illness and suffering. And so he had a theory based on his studies of a number of things. Magnetic healing, which is not actually using magnets, and mesmerism, which was named after a man named Mesmer, who was focused on trances and things like that, and just a variety of other studies of physiology. And he had this theory that one or the cause of human suffering and illness and disease, or dis-ease, as he put it, was that you could have a misalignment of a joint in your spine that would then put pressure on a nerve, and whenever you aren't getting a good signal across that nerve, it blocks the flow of vital energy to those organs or tissues, and then creates a state of disease or illness. In some of his writings, he said basically that God could not be expressed throughout the body because of some of these blockages in the nervous system from bones being out of place. And so that was his theory. That was the original theory of chiropractic. Around this time, he was in Davenport, Iowa. The building that he was working in, there was a man named Harvey Lillard, and I don't know if he was related to Damian Lillard. I sure hope so. Go Blazers! By the time you guys see this, we're either in the next round or we're looking forward to next season. So hopefully next round. But anyway, Harvey Lillard. About 17 years before he met D.D. Palmer, he was doing some work. He was stooped over in a position and trying to lift something heavy, and he felt a pop in his back, and he noticed that most of his hearing was gone. Like, he couldn't hear the hooves of horses out on the street, and he often couldn't hear when people were talking to him. He'd undergone a variety of medical treatments and therapies and things like that over the years, and nothing had improved for him. And so D.D. Palmer did an examination of his spine, found what he felt like was a bone that was out of place, and in Lillard's words, that he racked it several times over a few treatments, and he got most of his hearing back. And so he said nothing else had ever caused any improvement until this treatment was done, and that was the birth of chiropractic adjustments. And so things have evolved since then, because this might be a surprise to all of you, but all of human disease and suffering is not caused by bones being out of place in your back and pinching off the little cords that God uses to communicate with all of your organs and tissues. However, that does not mean that chiropractic is not helpful, useful, and every day making a difference to change people's lives for the better. Now, what things have evolved to include, or what evidence and research have shown us, is that when people have joints that aren't functioning or moving like they should, what that can do is it can irritate tissues that surround those joints. And so that's called joint dysfunction. And joint dysfunction can cause things like pain. It can cause things like, brain fog. It can cause limitation in range of motion. And over time, there's even theories that it would cause degeneration of these spinal segments, leading to things like arthritis of the spine. And so chiropractors are really concerned with making sure that those joints move normally. And so we do that through what's called an adjustment. An adjustment is a shallow, quick thrust of the joint. The goal is to get the joint to move like it should. When a joint moves like it should, the things around it tend to improve. In general, chiropractic adjustments are really safe. The most common side effects that people get would be soreness or headache, and even those are pretty rare. The most serious thing that can happen from an adjustment would be a fracture or a dislocation. Those are also very rare, which is one of the reasons that chiropractors have to be trained as physicians. We have to have good physical diagnosis skills, so we know when we may be working with somebody who it's not worth the risk to deliver a treatment. So the way that chiropractic is used throughout the world today is there's a lot of people that will engage in what's called wellness care, where let me start with acute care. So acute care is what brings most people in to see a chiropractor. Like, I have back pain, I have a headache, my foot hurts, my shoulder hurts, my ankle hurts. Or, you wake up with a stiff neck, or you've been in a car accident or something. So you have some sort of acute problem. And so then you go looking for some pain relief, right? So that's probably the most common way that chiropractors are used, people looking for pain relief. After people recover, what some people do is they will continue what's called wellness care, right? Or I guess the new term is salutogenic care. Salute meaning health, and genic means to create. So care to create health. And so some people will engage in that in an effort to avoid having problems and symptoms, and to maintain the health of their joints. And so that's another type of care that people will receive. And other things that chiropractors do, like in Oregon, there's a very broad scope for chiropractors. Chiropractors can do minor surgery in Oregon with certification. They can deliver babies. They can sign death certificates. They can counsel people in nutrition. They do physical rehab, very similar to what a physical therapist might do. We can order diagnostics, so MRI, X-ray, blood work, urinalysis, all those kinds of things. And so it really is a pretty full scope and spectrum of things that chiropractors are allowed to do, especially in the state of Oregon, which is one of the most liberal states for a chiropractic scope of practice. And let's see. Sorry, let me flip through my notes again really quickly, make sure that we're covering everything. I guess another thing that might be interesting about me is, and one of the ways that chiropractic is really growing and expanding lately is as it relates to sports medicine. So since 2011, I've been the chiropractor for the athletic department or here at Oregon State, working with all of the sports teams, so football, baseball, basketball, soccer, rowing, gymnastics, track and field, softball. I've probably missed some in there, but over that time, I've gotten to work closely with the athletic trainers, the medical staff that's here at Oregon State. That's how I met Emily, because I was working with the athletic department, and she works with the athletic department. And so it's really been rewarding and great. One of the reasons that people would want to work with a chiropractor on an athletic training staff is that we tend to get some quick results. So there's been times that I can't even count where, maybe there was a chance that somebody wasn't going to be able to play because they had back pain or stiffness, or this wasn't working or that wasn't working. And if we could get them adjusted, then they would improve to the point where it would be safe and reasonable for them to play. And so that's a valuable thing. It's also another perspective in terms of chiropractors deal with specific sets of issues that maybe like your orthopedic surgeon wouldn't, or your athletic trainer wouldn't. And so it's another set of eyes, it's another perspective, another way of looking at things that can be helpful as part of a healthcare team. And so for me, that's been really rewarding and exciting and a lot of fun. And that's really a way that chiropractic is expanding. Little known fact: currently, the medical director for the for USA Olympic the USA Olympics is a chiropractor. So he is overseeing orthopedic surgeons, physical therapists, athletic trainers, chiropractors, dentists, everything. So it's a guy named Dr. Bill Moreau, and he's been doing that job, and it's really kind of a cool thing. And it's really fun to be involved in sports medicine. So yay, sports med. In terms of the nitty gritty, the dollars and cents, which everybody always wants to know about, because if I like go out and become a chiropractor, am I going to be able to pay my student loans? Am I going to get rich? Do I get a Lambo? Right. So people want to know those. First of all, when it comes to the questions of like, will I be able to pay my student loans? First of all, you would want to know about how much those student loans are. So since it's 4 years of education after your undergrad, I would say on average people are coming out of chiropractic school today with anywhere from $200,000 to $250,000 in student loan debt. I took a guy to breakfast this last week who is going to chiropractic college in Missouri, and he said that he is on his way to surpassing that, which is an issue because it can be tough to pay those back. The difficulty is when you're a business owner, you don't always get a paycheck, right? As your practice is growing and it's developing, you have months where it's really pretty lean, and then you have other months where it's really pretty good. And so it could be a significant source of stress to try and pay those back. I'm still working on my student loans, for example. And so that's one issue. When you get out of school, there is no residency. You can just go ahead and go straight into practice. But if you decide to just go into practice for yourself, you have startup costs, a business loan that you need to get. You have to build a patient base. You have to learn by making mistakes. And so all those things can be pretty challenging. There's also opportunities to do associateships. Associateships aren't the highest paying jobs. Those aren't the highest paid chiropractors out there. But it is very good. It's kind of chiropractic's version of a residency before you go out and you do your own thing. But there is no formal residency to become a practicing chiropractor. So in terms of how much chiropractors make, let me see if I can pull up those statistics. There's a big practice analysis that was done in 2015, and it tells you, here we go. And so it was a big survey of chiropractors, and it tells you a little bit about their lifestyle. So I'll just kind of run through some of those things. So first of all, the majority of chiropractors are working between 30 to 39 hours a week. That's 44.5% of them. About 25% are doing 20 to 29 hours a week. 23% are doing more. They're doing 40 to 49 hours. And then 4% are doing between 50 to 59, and 2% are doing 60 or more, which, wow, I couldn't believe that. That'd be a lot. Okay. So the majority of us, though, 30 to 39 hours, and I fall right in that. In terms of practitioner gender, 72% of chiropractic practitioners in 2014 were male, 27% female. Ethnic origin, in 2014, around 3% were Asian or Pacific Islanders. 1.2% were Black or African American. So I truly am like a unicorn here. You're a Black chiropractor talking to you. 89% were white, 2% Hispanic, 0.3% Native American, 4% identified as multi-ethnic, and then 0.2% were some other type of nationality. Let's see. 95% of chiropractors hold a post-secondary academic degree in addition to Doctor of Chiropractic. So that's a master's degree in something else. And almost 2/3 of chiropractors have a bachelor's degree. 5.9% have master's degrees. 7% have doctorates in non-chiropractic fields. Let's see. Oh, goodness. Where's the part about the money? Everybody wants to know about the money. Sorry. I accidentally jumped right back up to the top of my document. Oh, okay. So patients per week. 36% are seeing fewer than 50 patients a week. Another 36% are seeing between 50 to 99. That's where I fall. 17% see 100 to 149. And then 5% see between 150 to 199. I don't know how they do that. That's a lot. That's too many. Where is the money? We're getting there. Most people, 90% of chiropractors practice in a chiropractic office. About 7 or 8% are in an integrated healthcare facility. And then, let's see, 74% are sole proprietors, 8% are partners, 13% of chiropractors are associates. Let's see, the types of therapies that we do. Applying physiotherapies like ultrasound, heat packs, electrostim, massage, teaching and supervising activities and exercises, taking x-rays, performing postural assessments, drawing blood, paraffin baths, orthopedic and neurological exams, all kinds of things. And I didn't find the money, but I think last time I saw it, the median income for a chiropractor is about $86,000. There's some out there that have multi-million-dollar practices. There's some associates that make far less than that. So there's kind of a whole variety of things, but after a few years, I think that getting into the $80,000-$90,000 range is pretty typical for people. So I think that I'm way over time. She asked me for about 20 minutes, and here we are at 30. But I'd be happy to answer any questions that you might have about chiropractic. I enjoy being a chiropractor. One of my favorite things is just being able to be there when people get better, and that's something that you don't get with some of these other professions. Like, for example, if you're a dentist and you drill in somebody's mouth and they leave your office and they're numb or they're sore, and when they finally feel better, you're not in the room. Or if I'm a medical doctor and I prescribe somebody a medication, they go home and they take it, I don't get to be there when the awesome happens. And what I really love is the times when people, they limp in, or I literally had a patient crawl in once and then they're able to walk out, because it's that powerful of an approach, and it works that well. So again, I'm Dr. Jason Young. The name of my practice is Body of Health Chiropractic and Wellness Center. Feel free to get in touch with me if you have any questions. Emily, thank you for letting me speak to the class. Sorry that I wasn't able to make it in, and I'd definitely be interested in doing it in the future, unless you really like this robotic version of me, and that's easy too. So anyway, have a great day. Go Beavers.